Good morning, Eva speaking from Spain.
Morning, Eva. Thanks for joining. Okay, we are going to kick off. So thank you, everyone, for joining the call. As always, I am recording the call. I'll send out the link later with the slide deck, and also we'll be sure to add it to the DSM folder as well as the EOD website. So there's multiple places now that you can find all of these calls. So please make sure you check them if there's any that you missed. So this is the clue in the title. Basically, this is the final call for EOD 2019, and because of that, we're joined today by the DSM teams, government affairs teams, as well as PR and comms, and of course, we're also joined by Tim from Canberra, as always. So welcome, Tim, and welcome everyone to the call. So just to kick things off, then, with a very top-line agenda. So you can see there's not much to discuss today, actually, which you may be pleased to hear. But the reason that we're in 45 minutes is because we want to make it a bit more interactive rather than just presenting at you. So we're going to be hearing from a few of the teams today, actually, in terms of the activities that they're planning in their countries. So please, if you do have any questions as we go through that stage of the call, please speak up, because, we want it, like I say, we want to make it interactive. We're happy to take questions, discussions. If anyone's being inspired or wants to do similar things in their countries, then of course now is the time to find out a little bit more. That's why we've scheduled in 45 minutes today. So to start the call then, I sent this out on Friday afternoon, and this is really exciting because this is the latest tool that we have at our disposal for European Obesity Day. So it is a gold standard activities guide, which we've been working on behind the scenes now for a few months. And actually, this is a real culmination of all of the stuff that we've learned over the last 4 years working with EOD. Basically, all of our knowledge, all of the success we've had has now gone into this gold standard activities booklet. So we're really hoping that this is going to be valuable for you to kind of just pick up, have a flick through. And of course, there's 5 gold standard activities, but this doesn't mean to say that those are the only things that you can do. In each of your markets, you know the markets better, you know what's going to work best in your market. So of course, feel free to still be creative. However, the ones in these gold standard activities in this brochure basically are the ones that we know have had, a lot of impact over the last few years. So these are the ones that we'd like you to focus on. But of course, as I say, we can be flexible and things that you can do as well. So that's the first thing. Please, if you haven't received this, if I've missed you off the email for whatever reason, then just email me after the call directly, and I'll make sure that I send this out to you. Just as we do with all of the call recordings, this is going to be found as well on the DSM box folder, but also on the EOD website. But like I say, if you want that directly after the call, just drop me an email. I'll send it to you. So without further ado, we're going to go straight into the country updates. And we're going to start with the boys in the Netherlands. So I know we've got Lutzer on the call. Hopefully you've pulled over now, Lutzer. And I don't know
if I have.
Hi. So I'm just going to ask Lutzer a few questions actually about some of the activities that they've planned in the Netherlands. What I'm also going to do at the same time is show some text on the screen. The reason being that, of course, some people like to read what's being said as well as when we're discussing it. So I'm going to start with the first question then, Lutzer, if that's okay. Could you explain a little bit to everyone on this call what EOD activity you're planning this year in the Netherlands?
Well, what we will do is we will organize 2 open days, one in the Spaarne Hospital, which was formerly the Slotervaart Hospital. They came from Amsterdam, and now they are situated nearby 15-20 kilometers further down the road in Hoofddorp. So Spaarne Hospital, and an open day in the OLVG, who we converted to our products in January. And what we will do is the open days to create awareness in the region for these two facilities. Both were known, but the situation is changed so much with them moving that we want to give them some extra attention in the regions. So that's what we're going to do. And during the open days, we are investigating live surgery to see if it will be possible to have a live surgery for the audience who will be former patients or future patients, general practitioners, other people who are interested to follow the surgery and have a moderator explain how the procedure is being done and why it is being done, and have a discussion around that. Also to copy paste a very successful event that Ronald organized last year in Catharina Hospital to organize a healthy cooking workshop. And those kind of things to really engage with the audience and show and explain what is all possible nowadays.
That's great. Thanks, Lutzer. And what's really nice to hear as well is that, of course, you've learned from the success from Catharina last year, and so basically you're trying to replicate that now in different hospitals, which I think is really great, and obviously great collaboration with yourself and Ronald as well. Okay, so next question then, Lutzer. What are the outcomes that you're expecting from these open days?
Well, the most important thing is to create awareness in general about obesity and about the problems it's generating for the people itself, but also for society. But to also explain for general practitioners, and I hope they will come, that surgery is one of the solutions as a last kind of resort solution to which is safe and effective to do, to also generate more traffic to hospitals in the referral networking from both the hospitals. And the third, but very important for both hospitals, to create more visibility for them. What I explained just now is Spaarne Hospital is starting up. They have the bariatric surgeons from the Slotervaart joining their team to set up the bariatric department there. But they need attention, and the same for OVG, who is now actually the only center of excellence in Amsterdam, but not really known to the bigger public in Amsterdam. So we need to help them create more visibility.
Great, and you mentioned Lutzer, that this is going to be aimed at GPs as well. So how are you going to be inviting those GPs? What's how do they come through the door? The most important, I think, and I don't know, I don't have that knowledge too well, but the most important part is to write invitations to them, to really get across a message in those invites. And then it is not only linked to the GP itself, but also in the Netherlands you have praktijkondersteuning. So you have the assistance of the surgeons, of the GPs that help a lot in the facility for the GPs. It is actually more important that they know of that we get across a message to them, than that they will actually visit physically. It is, of course, an extra bonus if they will visit, but their agendas are quite full as well. But it is actually more about generating that message to them
to spread the word, and that is something that we have to think about very thoroughly. With our internal communications team and with the communications teams of both hospitals.
Okay, great.
But maybe you have different view. Then I'm always willing to listen to that. But personally, I think that is the most important part, and and we hope to attract them also to through the live surgery. So that is, we hope to engage them through a live surgery part on the agenda, and with a good solid discussion on the safe and effective methodology.
Yeah, that sounds really good, Lutzer. And if there's people on the call as well that have run open days in previous years that have some ideas as to how to make sure that we get attendance here from this target audience, then of course please feel free to speak now or reach out to Lutzer behind the scenes to provide some support. But yeah, this sounds great. So next thing, you briefly alluded to it then, but just to go into this in a little bit more detail, in terms of collaboration within Medtronic and with the two hospitals, who are you actually dealing with?
Well, at this moment, we first started with the surgeons in the departments itself from the hospitals to see if they would be interested, and they both are. They're actually quite enthusiastic. And now we have set up, or at least discussed, with our internal team from communications, and we are finding a date in the near first 2 weeks from now to really make a step-by-step plan to organize it. So that's what we're doing, and some small things, for example. To organize already the areas in the hospital where you will. I'm always already made reservations of those areas that we can use it, and those kind of small steps. And actually, the file you just mentioned previous is very helpful. I used it a lot to make my own schedule. What do we need to do? Very practical information on how to set up that open days and what all kinds of small things that you have to think about. So thanks for that.
Oh, what in the new guide you mean? You're referring to?
Yeah, new guidance. Yeah. It's very helpful.
Oh, great. Yeah. You already had a look. Oh, brilliant. Thanks, Lutzer. That's great.
Yeah.
And I know there's also been some questions as well. Maybe some members of the team are thinking, okay, we'd love to do an open day, but we're not really sure how to approach it with the hospitals. And I think you hit the nail on the head here, Lutzer, is that your first point of call here was with the surgeons, getting them on board, and then they can obviously open the doors to the right people in the hospital. It's just the right questioning from your side. If the surgeons are up for it, then of course they're going to help introduce you to the communication managers or the people that are going to need to be involved for these open days. So I think the surgeons really are the place to start for those people that are considering doing hospital open days. Just talk to your customers, and if they want to do an event like this, then they will help you. They will support you finding the right people. And yes, as Lutzer says, the guide now should help you in terms of your planning and all those little things that you need to consider to be able to organise these open days. Okay, great. So, Lutzer, what so far is working well when it comes to the planning around this? I know it's a bit early stages, but what's working well?
Yeah, well, till now, communication is very nice. My interaction with our communications manager in the Netherlands has went very well. The guidance book is really helpful. So those things are going well, and probably in the next few months we will also see some hiccups here and there, and
Yeah.
But till now everything is going well. Looks good.
Okay, so that really answers the next question then. You haven't experienced any challenges yet, but obviously you're aware that challenges could arise in the next few months. So I'm sure you're prepared to face them if they do.
Well, the biggest challenge for us, but that's not really linked to the open days, is that there's rivalry between the both hospitals that we just mentioned. So therefore, we also chose to do a regional approach. They are in the same region, and we both will offer them the same help and guidance and visibility. So that will be our main challenge to. That they are not jealous of that we're also helping the other group. So that is manageable.
Okay, that's great. So does anyone on the call have any questions for Lutzer at this stage? We're coming to the end of this section now. No? In which case, very clear. Thank you very much, Lutzer. You did a great job. We look forward to seeing what the outcomes are. So thank you for joining us today.
Sure. Thank you. Yeah, bye-bye.
Thank you. Thank you. Okay, moving on then. We definitely have Philip on the call. I'm wondering if Marianne is also on the call as well.
Of course.
Amazing. Thank you, team. So as you can see, the next countries we're going to speak to are Switzerland and Germany, and that's because they're doing an amazing initiative together. So this is true collaboration across the Medtronic teams and across countries, which is why we wanted to showcase this particular activity today. So without further ado, I think Philip is going to take the lead on this, and then of course Marianne, please, come in and say anything that you feel would be helpful as we go along. So Philip, are you there?
Yes, can you hear me?
Wonderful. Yes, I can hear you. Very similar format to what we've just gone through with Lutzer. Just to kick things off, please can you tell us a little bit about your EOD activity?
Yes. It all actually started with the discussion, Germany and Switzerland, Marianne, myself, and the communication team in Switzerland and also in Germany, where we talked about how can we create awareness, how can we create traffic, how can we get visibility on all these topics in order to address all these challenges in obesity. And as we all have very limited resources in terms of money and also manpower, we were looking for a big story. And actually, luckily, we found a big story. It's called the Camino Project. And the Camino Project is actually a project with the goal Start Together, Arrive Together, where patients with obesity will walk the Camino Portugués to Santiago de Compostela. So we will have, or we are able to sponsor an activity of one of our partners. So this Camino project has actually two groups of patients who will walk the Camino Portugués and arrive on the European Obesity Day in Santiago de Compostela. Luckily, we had also 2 weeks ago the chance, and this is actually now the story which we would like to share, is that we had a fantastic chance to interview all these patients at the University Hospital in Zurich, where we talked about their story, where we talked about why they are going to participate on this Camino project. And also we had the chance to participate on the physical and medical checkups which were done upfront by a medical team in order to prepare all these patients that they are able to walk this route. And therefore we have now a fantastic film package together, luckily based on the support from the communication team, Michelieu, and also Germany with Eva and team. And yeah, we are now looking forward to share this content as much as possible in different channels with different hospitals and partners so far. Yeah, maybe Marianne, you would like to add something to what the European activity is all about when we talk about Germany and Switzerland.
No, I think everything is there, so it's fine.
How many patients do you think are going to be taking part in this? Do you have a final number?
Yeah, not confirmed. I think it's about 24 patients.
Amazing. And that's patients from both Switzerland and Germany?
Yes, and the good thing is also that we're going to have the opportunity to get film material during the obesity day, so they're going to film themselves and send us an update, how they feel, etc. So we will have also during the walk some feedback back from the patient, which we can use and share on social media, for example.
That's brilliant. So kind of you're starting to move on now to kind of the expected outcomes. So obviously using those social media channels, but what other outcomes are you expecting from this activity?
Yeah, with this video material, we try to have as much as possible visibility. That means we are going to involve different partners, and it's all about first the patient. So we would like to address actually three topics: health for self-support, more patients with obesity to contact self-support groups, which means we also are in close contact now with the biggest self-support groups in Germany and Switzerland, that we can share this content also with the groups. And secondly, it's all about strengthening their self-esteem, and this is going to be done with the message through the feedbacks of all these obese patients who will walk the Camino route. And last but not least, it's all about we can fight obesity together, where we try also to spread out this message with different also interviews, which we have done, for example, with surgeons, with bariatric nurses, with leader of self-support groups, and also with endocrinologists.
Okay, brilliant. And what I love about your last bullet point there is that obviously it's very much aligned to the EOD tagline, which is tackling obesity together. So, that's great. We're sending, a very consistent message across this platform. So that's really good. Okay, next question. Who are you collaborating with, both internally within Medtronic, but also, very importantly, externally?
I mean, internally, I've already mentioned that without the fantastic support from the communication department, I think that wouldn't be possible because, it's a big, immense work to produce such a video. And then, we are now also in progress to use more internal resources because, it would be good to have more power to produce other things and also to connect with other partners. When we talk about partners, first of all, we definitely going to address the healthcare providers, the hospitals, so we create short clips, short video materials which they can use on their channels to spread out the message. And then secondly, the first try, we would like to involve also insurance companies to see if they are willing to share this message on their channels, on their communication channels. And then what I have already mentioned, we have different self-support groups which we are in contact, and we try to collaborate also with them because they have also very, very big network to all these obese patients.
Okay. Marianne, would you like to add anything at this point?
Yeah. So the insurance company are very open for it. So we have good recognition this week. So we want to share it, but in the end we will see if they do it. Yeah. Also, doctors are very interested in it, and I think it's good. So also the sales force, of course, is included in this project, but in a second line. So the most work is done by the marketing team and by the communication team.
Okay, great. Nice collaboration then internally within Medtronic. So great to see, Marianne. Okay, fourth question. So I know you've alluded to some of these things already, but just to reconfirm, so far as you're planning this event, what's working well for you?
Yeah, working well. Definitely the collaboration between Germany and Switzerland and all the internal departments so far. Actually, and this is just a Swiss view, self-support groups in Switzerland are very open to collaborate with that and are very happy that we invest in such a campaign. Also the content, it's great to share that we don't have to produce twice similar content for Switzerland and Germany. And I think, Charlotte, maybe you can talk about this point a little bit more. I think we also get interest from EASO regarding the project. So that's also something fantastic that even EASO is now all open to share this Camino story.
Yeah, I actually, I think we should talk about that point a little bit. Tim, are you able to take us through how this came about and the comments that we've had so far?
Yes, indeed. In fact, it's great because they are really, they're really keen on this. They really love the idea that the patients are involved and so on. And they have even asked that somebody from EASO will hopefully be able to join them during the last stages.
Right.
So fantastic, and as far as the film and that sort of thing is concerned, EASO will be able to use it as well. So very well done.
Great, thank you, Tim. And then just the last question here then for you, Philip. So what challenges have you seen so far, and kind of what have you thought about, or how have you overcome them?
What I mentioned at the beginning, I mean, with these limited resources, it's a big challenge to get visibility. Because normally you would need much more money and also manpower, and therefore we were looking for a big story which can create this awareness with less money. And I think this is at the moment the biggest challenge, and also the biggest challenge is to find enough time besides our daily work to support such an initiative.
Be careful.
Yeah.
Okay.
Yeah.
I don't want you to get caught speeding.
No, I know that.
Stop
People
speeding,
go on
Tim.
mute, please, if they're driving or having arguments with people.
Yeah. Maybe Marianne, you can also address here some challenges from Germany so far, what you have faced.
So the most challenge we have is to involve the big patient groups. We work with them in different projects, but to say, come on, the other patient group has a great idea and want to share it, please be a part of it. It's really a political issue, so we have to handle it very softly. But in the end, everybody is will be a part on it. So it's for them also a great opportunity. So yeah, but it's a challenge. And the HCPs, they are not involved with patient or interviews. Are also a little bit. So what's my benefit? So the interest is low there. Yeah. That's, but some of them are open for it and some not. So yeah. So
Okay.
I totally agree with Philip.
Thank you very much. I think for the interest of time, we'll move on now. But of course, if there's any questions or if anyone wants to know any more information, then please, raise your hand after the call or contact Philip or Marianne separately, and we'll get those questions answered for you. So, Philip and Marianne, thank you so much for your time today. Really appreciate it. And this is an amazing activity, so really well done so far. Okay, moving on. Valeria, would you like to take the reins here to talk through a government affairs initiative?
Thank you, Charlotte. And thank you also for getting us all together on this call. It's great to see this multidisciplinary group together and the collaborations going on in the different markets on the different projects. So there's a lot of exciting ideas and programs which are being pulled together. I'd like to just very briefly introduce one of the activities that the government affairs team in the region, together with the other colleagues, of course, in the other functions and in the business, have been putting together. And a very interesting one that, although is still somehow under further development, is being led by our French team. So I'd like to maybe ask Alexandre, who is leading the activities for EOD in our team in France, to maybe tell us a little bit about what is the plan for the engagement in France. Alex?
Yeah, hi. Can you hear me?
Very well, thank you.
Hi, good morning, everyone. Yeah, thank you, Valeria. So, as for France, we have several events planned. First of all, and I would like to thank the business team, Myriam, Emmanuel, Laurence, who have been working very hard to get some really interesting events for EOD this year. First of all, we will take part in an event hosted by the city of Valenciennes in the northern region of France, where obviously obesity is a very, very important issue. This event is co-organized by the city of Valenciennes as well as the local hospital center. Myriam is particularly working on this event. What we are planning to have is have a Medtronic stand inside the city hall, where we will be able to give out leaflets and information to patients about obesity, the importance of nutrition, etc. Secondly, we have, like we did the previous years, we have a partnership with the main patient association in France, which is the CNO. We have a very close relationship with the president of the CNO, and Sophie Joly. What they will do is they will include us in their communication plans on the national level. So Medtronic logo will appear on the different communications of the CNO. They will also make sure that we have good media coverage on the events we will take part in. So the president, Anne-Sophie, will call the journalists she knows, and she knows lots of journalists, and she will let them know what we are up to in the various parts of the country. And after the event, which is really interesting for us, Anne-Sophie will give us a detailed feedback on the media coverage and how Medtronic has appeared in the media, as well as on the social media. So this kind of feedback is really important for us because it will allow us to know what worked, what didn't work so well, so that we can improve for the next years. Also, I will be present in Brussels on the 16th of May. Anne-Sophie Joly from the CNO will be here as well. And I have identified a couple of MPs, so French members of parliament, who work especially on obesity issues. They happen to live and they happen to come from the northern region of France. So Brussels is not very far from where they live. So they might be able to come to the event. And I have to thank Tim, who has been really helpful. He sent them the invitations at the end of last week.
Excellent. Thanks, Alex. Indeed, the conference remains a great opportunity, I think, to engage national stakeholders. And so several of you have already provided inputs on who to invite and possibly meet also on a one-to-one basis around the Brussels conference. But if you haven't done so, this is a call maybe to do so and signal any interested stakeholder who would be interested in the policy discussion. Alex, what are you expecting, beyond the media coverage, of course, you refer to, and the opportunity possibly to meet with the MPs? What are you expecting from the event with the municipality in Valenciennes or in other cities?
Well, I guess it's really important, especially for the business team, to have closer links with the different HCPs. And I think for the EOD is really a patient focused, and the main point is to get people around the country to know more about obesity. It's really about prevention, and I think it's really good for Medtronic to be identified as a stakeholder on the obesity issue, because most of the people in France don't know what Medtronic is, and the few of them who know who Medtronic is think we only work on the cardiac issues. So I guess it's a good way to expand what people know of Medtronic. And as it's written on the slide, especially on the longer term, it's really important for us to get to meet members of parliament, because this is something we really have discovered with Basile, is that all members of parliament in France don't know what medical device is. They think pharma and medical device is the same activities, so they have to know what MD is, and it's really important for us to get to know these people and to explain to them what we do, in this case on the obesity issues, because the MD regulation in France is really moving quickly, so we will need allies on this debate.
Great. It's great to see the connections you're making with other, issues, of course, and taking this opportunity to highlight them. You referred to the collaborations internally and externally. What is working well, or challenges that you face or you're still facing? Can you tell us a little bit about that?
Well, obviously the bariatric business team knows its business very well, so they know the people. They had been in touch with the patient association well before I arrived in the team. So they have all the connections they need. So they once again, for instance, Myriam went to Valenciennes because she knows the people there and she knows the HCPs. So they did a fantastic job. So I believe the collaboration with between the business and the government affairs team are really good. And as I said, we have quite a close relation with the CNAO. Actually, we can talk quite frankly with her, which is good because we need to make sure that we are really aligned on what the objectives are.
Fantastic. Okay. Thank you. That's clear. You had mentioned that there was probably still a bit of alignment to be found internally also on the, eventually other locations, or this is a firm plan for Valenciennes?
No, Valenciennes is still evolving. What is sure is that we will be we'll take part in this event, but we need to keep on working with the city of Valenciennes as well as with the hospital center to really understand how we can be the most helpful and what they really are expecting from us.
Great. Thank you, Alex. It's a great example of the type of activities that we can build together and how we can leverage maybe existing opportunities for introducing the government affairs and policy advocacy aspects. Thank you very much. I invite, of course, all the other teams and colleagues who are in the making, some who have projects in the making, to share them in the next days, or maybe get inspired from the ones that have already been shared so far. So, Charlotte, I turn back to you maybe for opening to questions if there is time.
Yeah. Are there any questions at this stage for Alex or Valeria? Everyone's very shy on this call today. No questions? You must have made it very clear, Alex. Thank you very much.
Thank you very much.
We're flabbergasted.
Flabbergasted. So good, so good. Okay, so we're just going to close the call now, but of course, before we do, final reminder is that you can find all of the tools, resources, EOD-related information. Basically, everything you need to know is on the EOD website. So you go to the website, there's a collaborators button in the top right-hand corner. You then need to log in. If you're not an EOD country lead, you can just use the generic username and password that you can see on the right-hand side here. And that will give you access to all of the Medtronic information. So this is it. This is the final call. So, you know, it's our last opportunity as a full team to say thank you and good luck for all of your activities for EOD this year. Of course, just because this is the final call doesn't mean to say that I'm going to be leaving you alone or forgetting about EOD. So there will still, of course, be some EOD newsletters coming out in the following weeks. And as always, you know, myself, Valeria, Tim, Lars, we're always here to support you. So if you have any questions or any concerns, or you just need some extra support, please feel free to reach out to us and we'll do our best to help you. But if there's no further questions, then we can close the call, and I wish you all a really good day.
Thanks, Charlotte.
Thank you.
Thank you. Good day
Bye-bye.
for you as well.
Thank you. Bye.
Bye. Bye.